All right, I believe we are live. I'd like to welcome you, Nancy. Thank you for joining me for this important discussion tonight. For everybody joining us here, Nancy is the Executive Director of Youth Outlook, which is a social service agency that serves LGBTQ youth and their parents throughout 6 counties, I just learned. So covering a very large area. They serve families through drop-in centers that provide support, through a parent support group called Thrive, and through community education, targeting educators and professionals who work with these youth. Nancy is professionally trained as a social worker and more recently as a pastry chef, which I do want to learn more about as well.
You got it.
Awesome. As a mom, as an aunt, and a teacher myself, there are actually a lot of LGBTQ youth that are very precious to me and for whom I wish nothing more than that they have access to what they need to thrive in this world. And as an aspiring legislator, I'm eager to hear from someone who has experience and knows a lot more about this area about advocating for LGBTQ community, specifically youth, about how policy can positively impact their ability to thrive. So I have a number of questions. Some came from people who are interested in this event. Some came from some reading and things that I've seen out in these discussions. And I look forward to hearing your perspectives, your experience, and your feedback on these questions and issues. So jumping right in, the first question I have here is with regards to the REACH Act, which is specifically SB 2762, the Responsible Education for Adolescent and Children's Health Act. It's a piece of legislation that requires public schools through kindergarten through 12th grade to teach medically accurate, age-appropriate, and culturally inclusive sex ed program that affirms LGBTQ students and is inclusive of their health and wellness needs. I assume that you're somewhat familiar with this piece of legislation, and would love to hear your thoughts on the various ways that you think this could positively impact young people in Illinois, and not just LGBTQ youth, but everybody.
Students. Okay. Hi. Yeah. Thanks, Martha. I'd be glad to chat about that a little bit. Over the years, Youth Outlook has done an extensive amount of HIV prevention education with our youth. So we've had the opportunity to interact with them and find out a lot about where they are on the learning curve in terms of sexual health and what they're bringing, like their take-home messages would be from schools now across, as you said, 6 different counties. And there's an enormous range we're finding of gaps left in the information that our students are getting or able to apply to their own behaviors or their own bodies, which is also very important. So over the years, we've seen students coming out of schools where there's a very progressive take on what should be taught, and the students have we just kind of fill in the extra information that is specific to LGBT students. And then we've had students who are coming out of schools that they would not describe as progressive in their words, and talk about really basic information that they're lacking, even in terms of not being able to identify body parts, not being able to identify what those body parts do, not being able to discuss sexual health in a manner that would be considered helpful as they reach the age where they want to consider dating and becoming sexually active people. So we've had opportunity to work with our youth around topics that are broad healthcare issues and also some very specific LGBT related issues. Because of our HIV prevention funding, we've had the opportunity to do some prevention education around that specifically, and then also look at the larger topic of STIs, which some students are getting information about and some are not. And even when they're receiving information about that, they're not always receiving information about it in a way that makes sense to their dating behavior, or they don't hear it in that way. So having information that is available and specific to LGBT students, I think would be a huge, huge step to giving them good footing to get into relationships, to get into dating, to become really active young adults. I think this is it is time. It is past time.
Mm-hmm. It sounds like it would fill gaps that might exist, not quite
For sure. For
evenly
sure.
distributed, but it would help fill
For sure.
in.
There are some very specific health related things.
Mm-hmm.
And I know that we're talking about a smaller population of people, and that in curriculums in schools, especially large schools, teachers may not have time to get to these other topics. But there are things about LGBT health that our young people need to be aware of as they're moving into adulthood. We need to be aware of the specifics around cancer, specifically breast cancer among the lesbian population.
Mm-hmm.
As far as I know, we don't have schools that are teaching that. And we've met an awful lot of young female identified people who don't know how to do the basics of a self-breast exam, to look for any kind of lump or something that would be concerning for them. Some of the young folks that have been coming through wouldn't know how to do a testicular exam for a self-testicular exam for testicular cancer. Those are two things that are important, both to their age range and to the fact that they are LGBT. So there are lots and lots of topics, and that's just two out of a list of topics that we could probably spend the entire half hour talking about, in terms of what they need to know to live healthy in the bodies that they have.
All right. Our next question that we have here is, in Illinois schools, 80% of youth who are trans or are perceived as trans report some form of mistreatment at some point between kindergarten and 12th grade. This mistreatment can include verbal harassment, being prohibited from dressing according to their gender identity, encountering harsher discipline than their peers, or being physically or sexually assaulted. Furthermore, 88% of LGBTQ youth in Illinois have heard the word gay used as a pejorative. In addition to improving representation through education of young people, as was passed by the state last year, introduced by Representative Anna Moeller, what more can be done at a policy level to reduce the instances of mistreatment of LGBTQ youth?
I think we have taken a couple of helpful steps in just the last couple of years. Representative Moeller's policy is one of the biggest things that we're going to see make a difference. We need to put this topic in the landscape. It just needs to be part of conversation. So having the inclusive curriculum bill come out and going into effect very soon, I think is going to make a difference for LGBT students. As we've been tracking bullying rates over the past few years, if you look at the GLSEN survey, the Gay Lesbian Straight Educators Network, starting probably 2008, 2009, that area, we started to see a decrease in bullying, all forms of bullying, in the schools until about 2015. So we saw decrease in these every 2-year surveys. And then in 2015, we saw an uptick in every single category. And we have plateaued in most of them since 2016. We're hearing lots more stories anecdotally from our youth about comments being made at school, and not just by students, which is very alarming, but by teachers, or teachers who are turning their backs on situations where they see a student being handled roughly in the hallway, being shoved, being put in a hold or punched, and turn their back on it and make the comment of either they didn't see it or they didn't realize that it was a problem, and the student is feeling very vulnerable and has in some instances had to put up with that kind of behavior repeatedly without assistance from the school. So getting this topic out there in front of the faculty, making them aware. I think we have to set some policies around how teachers are trained to intervene when they see those situations happen. Our kids are reporting, they're reporting being hurt. And if there's anything that we can do at the policy level to change that, the faculty is where that's going to begin. We have to give the faculty what they need to be able to support the students.
Yeah, it is heartbreaking to hear not just the physical harm, but the emotional harm as well for those kids must be really hard. And getting teachers involved. As a teacher myself, I hear you. I mean, it is important, and you can't turn your back when that's happening. So it is important for teachers to understand and to fill in that information for them to have that understanding that this is happening.
This is happening.
Kids are reporting it, and it, we need to be paying more attention. Absolutely.
And sometimes even when the faculty members are seeing it, they don't know what to say. They don't know what to do to stop it. So let's give them some tools around that.
That makes sense. And the next question here actually might relate to that one as well. And this is looking at the issue of intersectionality. So intersectionality, if people are not familiar with it, it's a term that was coined by Kimberly Crenshaw and defined by the Merriam-Webster Dictionary as the complex cumulative way in which the effects of multiple forms of discrimination, such as racism, sexism, and classism, combine, overlap, or intersect, especially in the experiences of marginalized individuals or groups. It is critical in discussions of current issues and comes into play in policy as well. Can you, Nancy, speak to the significance of intersectionality in the current moment?
I will lead off everything I'm about to say with the observation that I need to be aware of my own privilege while we're having this conversation. I can bring forth the statistics that our students, as you said in our last little segment, subject to harsher disciplinary measure. When we were talking about LGBT students, that same is true. We're finding in the research in Chicago that there are categories. So it's not just LGBT students who are subject to harsher disciplinary measures. It's also Black students. It's also the students with a disability. And when you have a student that holds multiple identities, they're usually getting the worst treatment of them all. So there's kind of this layering effect of being treated disrespectfully all the way through being treated with open hostility, being removed from classrooms, all the way through being arrested and having a law enforcement contact because of the identities that you're holding. There are a couple of things that popped into my head when I first saw this question from you. One is I have a favorite quote by one of my colleagues, Krupa Patel, who now works at Kenneth Young Center. While Krupa and I were working on a presentation, Krupa observed that they do not experience racism on one day and homophobia on another day. They experience it all at one time. So they experience racist homophobia and homophobic racism every day. You can't pull those things apart. Those are about who Krupa is as a human being, and that's how we're addressing those. We're doing the layering to people that we come in contact with by putting them in those little boxes that we like to think of people in. The other example that comes to mind is speaking from my point of privilege. I remember being a young person, a young LGBT person, and doing some not well thought out things as young people do.
All young people,
right? All young folks do that. We have a knack for that. But in comparing stories with one of my colleagues who is a gay African-American man, we noted that my mistakes as a young person, with my Catholic school uniform and my bad haircut, and I was this, young white woman, I got sent away to college. He got sent away for 3 years. There are enormous differences that we have to address.
Yeah, and that affects the community, not just the individual, too.
Yes, absolutely. Yeah. The family, the ripple effect off of that into the larger community, there's no way that it can't.
Thank you for sharing that. Those are some good
You're welcome.
Insights for sure. All right. Actually, this next question is also related, again, to what we were just addressing. LGBTQ people are overrepresented in the criminal justice system. For instance, nationally, 1 in 5 young people who are in juvenile justice facilities identify as LGBTQ. In fact, LGBTQ young people are 4 times as likely to be caught up in the criminal justice system as their non-LGBTQ peers. And in Illinois, 69% of trans people who interacted with law enforcement officers who thought or knew they were trans report experiencing some form of mistreatment. Issues around policing are being highlighted in public discourse more than ever right now. And pride originated in the Stonewall riots, with Black trans women protesting police treatment. Are there any policy suggestions that you've seen discussed recently that you think would also have a positive effect on treatment of LGBTQ people by police?
I think this is a yes and a no answer. So yes, I have seen some policies. I have colleagues that serve on our community networks that are part of the police force. They do talk about the changes that they're trying to bring to their departments. That's a great first step. As an agency, Youth Outlook is supportive of moving some of the funds that have been put into policing traditionally into the mental health system, into the healthcare system, into the education system. We've got to make these changes. Our system is broken. We cannot reclaim this. It is too far broken. So those things need to happen. At the same time, we're seeing officers who are beginning to look at policies and say, hey, this is not working and we've got to change this. So I think there's a two-prong approach to this. There needs to be our push from the outside. From the inside, for what remains of police departments that will continue to be funded at the levels that they are, and we'll see what happens with the newer situations of departments that have been defunded and or funding rechanneled. I've seen suggestions around helping educate the officers around what to do when you stop someone who is trans. How do you address them? Do you understand that these are the issues that they might already be facing even before you pull them over? They are already afraid of you. They are already afraid that something horrible is going to happen. Are you aware of that? And is there anything that you can do to de-escalate this? We all need to be focused on de-escalating these situations. We talk to our Youth Outlook kids. I've had several conversations with Youth Outlook young folks, and they talk about the fear that they live with in terms of ever being stopped because they're sure it's not going to go well. So the police being aware of that and actually wanting to work on that, they need to call their own out. We need to ask for that. They need to stop looking away when something goes wrong and somebody gets hurt. Those things need to start within their system. That's not anything that I, as a social worker, can do from my job at Youth Outlook. That's something that they have to be educated on. They have to be alert to it. They have to be willing to do it. That's what I would ask for.
Yeah, it does. It seems like a lot of these issues are similar in that it takes a personal commitment and a community commitment and a systemic commitment to not looking away and to addressing the serious concerns that exist in the community.
Yes.
Our next question here. Nationally, 57% of LGBTQ people report that they're not treated equally in the healthcare system. In Illinois, 33% of trans individuals who saw a healthcare provider reported having at least one negative experience related to being trans.
Yes.
These experiences included being refused treatment, being verbally harassed, physically or sexually assaulted, or having to teach the provider about trans people in order to get appropriate care.
Yes.
Additionally, 24% of trans people in Illinois did not see a doctor when they needed to because of fear of being mistreated as a trans person.
Yes.
What do you think can be done to make seeking and receiving medical treatment a more positive experience for LGBTQ and especially trans people?
One of the first things that comes to mind is get on top of your paperwork. When you walk in, the first thing that we're all asked to do when we show up as a new patient is fill out a form. Make sure that there is a place for us to put ourselves. I still walk into healthcare offices that still offer me male and female. Those are your only two options. So there are easy things that the medical system can do to make people feel visible when they arrive. We've worked with one of the larger healthcare organizations that was able to add fields to their intake form, the computer intake form, where they ask for the name of patient and pronouns needed. And then there's a separate space for the information that comes off the insurance card, especially for our young trans folks. Sometimes they don't have the funds. Sometimes they haven't had time to. Sometimes they don't have supportive parents to get to court to change their names. So it's the old name on their insurance cards. So if it has to be billed under the old name is on all of their paperwork, and then they're being constantly called their dead name, which makes them feel disrespected, sometimes even invisible. There are things that we can do to make this a much smoother process for them. We need to recognize that trans people and non-binary people exist, and they're going to come for healthcare needs. And we need to start training our doctors. There needs to be some education for them in med school around the unique needs of LGBT folks.
And that just seems like it makes sense.
I think it does. I'm not sure where in med school they would put that, or if that becomes some kind of rotation or something, but it does need to be worked in somehow. There are also some policies around not dealing specifically with trans issues, dealing with, let's talk about lesbian healthcare for just a moment. Every time I've had a surgical procedure, I have been required to take a pregnancy test with my wife sitting in the room, and the hospital insisting they will not proceed with whatever that process is. I can't have that, whatever it is, until I take that test. Talk about dehumanizing. Talk about insulting. I mean, you're not only implying that the person who is sitting here is somebody that is not that important to me, but that when I step out, I'm also going to be stepping out with a man. Give your client some respect. We know who we are.
Dignity.
Yeah.
It's important for everybody.
We also have a serious lack of docs in the western suburbs who are educated on working with gay men's health issues. And we have one of the larger healthcare providers within DuPage County has no docs. If you call and ask, they will tell you they have no docs. They do not treat trans patients.
Wow.
It's a huge thing. Most of our young folks travel into Chicago to get healthcare. They're either at Howard Brown or they're at Lurie Children's Hospital. Why is that?
Anywhere any more rural, it's just as bad, if not worse.
It's worse.
Yeah.
It's worse. So then we would be looking at folks who simply don't go for healthcare, because I'm right now talking to you from DeKalb. To get in my car and drive to Chicago right now would be about a 3-hour drive given traffic. That's a whole day to come in for, what might be a half-hour doc appointment. But there's nobody in the western burbs who can do some of the specific stuff that we need.
And that might feed into that 24% of trans that don't go to the doctor, trans people that just don't go because where are they going to go?
Right. Where are we going to go? You find the one doc and everybody flocks to that doc. That's been known to happen out in the western burbs. Who's your doc? Who do you see? You like them? Are they good with this? They're going to be okay when I come in?
Thank you for sharing that insight. I appreciate that. Next question. According to the Williams Institute at the UCLA School of Law, 25% of LGBTQ people live in poverty in Illinois versus 14% of cisgender straight Illinoisans. As a whole, LGBTQ people have at least 15% higher odds of being poor than cisgender straight people. This impacts the quality of life of LGBTQ people in Illinois and their ability to prosper. These stats absolutely shocked me. Maybe I shouldn't say they shocked me. Something surprised me, take me off guard, but sadly not terribly surprising. I imagine they shock a lot of people who are listening. What do you think contributes to these stats? And do you see a path forward through policy or anything else that we can do in the community that could alleviate this poverty or prevent that poverty even? Or do you think that there are preventative measures that we could be taking?
One of the things that I'm sure is feeding it is the fact that LGBT young folks are more than twice as likely as their cishet counterparts to have some kind of disruption to their schooling, to not make it to school or not continue their schooling after they hit the high school graduation point. We have a higher dropout rate. We are often pushed out of school. In a situation where we've got folks with PhDs and master level educations competing for jobs, the folks who have stopped at the high school level are going to struggle. It makes it difficult to land the dream job. It makes it difficult to earn a living wage in the jobs that you're in. So that, I think, is one of the things that we do need to take a look at. Our not ability, that's not the right word, our risk of having our education interrupted. And that's usually linked to hostile environment. So again, going back to school policies, we may see some change as we move forward with this introduction of the inclusive curriculum bill. The other thing that I think makes a big difference for LGBT employment is, hello, hire us. Hello, I work in the not-for-profit field, and I can name you, I've been doing my job for almost 23 years. I can name you exactly one other lesbian executive director in all of Northern Illinois. Wow. So hire us. We are not hired at the same rate. We are not recruited for jobs at the same rate. We are not nurtured and groomed for management and leadership positions in the same way. Hire us. A couple years ago, more than a couple years ago, it's probably more like 5 or 6 years ago, we were working with PepsiCo in Chicago, and they wanted to do something for, I think it was National Coming Out Day, and it was, would you bring the youth leaders in and we'll give them a tour of our building and we'll show them all around and talk to them about our recruitment policies, because we are a very friendly company. I was like, yes, we're come on everybody, get on the train. We're all gonna go down and meet the folks from PepsiCo. And they did this wonderful tour where they took the youth leaders around the building, and the one thing that they showed them that the folks who were with us that were just riveted to, they walked us through their social media area, and even I was really, really impressed by this. It's a giant room with glass walls and TV screens all over the opposite wall, dozens of TV screens, and there were, I don't know, a half dozen employees in there monitoring. Anytime a reference to a PepsiCo product was made online, they were the people that were responding. And I remember the kids standing there talking with our guide about how PepsiCo was specifically reaching out because they knew LGBT people had different experiences and would enrich their pool of talent. And it was eye-opening for some of our kids. It's like, you're not just humoring us and you'll say that you'll hire us. You're actually seeking us out because we have these different experiences. That's what I want to say.
Yeah. That would be
so when we move in the direction of our kids being recruited specifically for and being moved into management positions and being made executive directors and CEOs, we'll start to see a change in that poverty rate.
Yeah, that would be great. Looks like we got a question online. Someone is asking, how about the Rockford area for health and housing? Or I guess they're asking what the Rockford area is like for health and housing for LGBTQ people.
For housing, the only LGBT specific housing that I'm aware of outside the city of Chicago right now is in Naperville. So there's a transitional housing program at 360 Youth Services, run by the very fabulous Carolyn Walskog. They've been there a couple of years now. Other than that, there's Schaumburg and Chicago. There's not a lot of housing dollars being pushed into LGBT services. In fact, nationwide, we're seeing some of that being cut.
Are you familiar with any specific healthcare providers that are known to be supportive or knowledgeable in the Rockford area?
The Rockford area, no, I would have to look into that and get back to you.
Okay. And then I think
Spectrum of Rockford would likely, I'm sorry, I didn't mean to cut you off.
Nope, go ahead.
Spectrum of Rockford would likely be a great place to ask that question of.
All right. We got one more question online. Are there protections for LGBT employees to prevent termination based on sexuality or gender?
Just happened last week. The Supreme Court just put that through last week. We need to see how that's going to play out. Up until last week, Illinois had its own state law, but now that it's federal, let's see what happens.
Yep, that was some good news last week.
That was some big news for us. Yes, it was.
All right, I have a question that I've been really wanting to ask you. If you, Nancy, had one or two asks of people who are listening, what would you encourage them to do that would have the greatest positive impact on how LGBTQ people are treated and represented in our community? So I know you've mentioned a couple things, a bunch of policies, some very specific things people can do, but if you had one or two asks for people to take away from our discussion, what would that be?
There are a couple really easy things to do that don't have anything to do with policy. Be visible. Make us visible in your community and be vocal. Speak up when you hear something being said. Speak up when you hear things not going well or people being targeted. Just last weekend, we held the first Pride flag hunt in Naperville. It was this absolutely ridiculous thing that we did instead of doing, because many of the Pride events got canceled or postponed due to COVID. And I dreamed this up in my little brain and said, hey, 360, I can't challenge you to a softball game. How about a Pride flag hunt? And we'll just go and identify, and whoever counts the most flags wins the most points, and then they win the game. And we did it for an hour. It was ridiculous. But in the process, it was just total silliness. In the process of that, 4 different subdivisions let us know that they would be decorating for that event so that we could come and find flags that they had put out for us. I remember all too well my arrival here from Syracuse and not seeing a single rainbow anywhere. And now I look at Naperville, where I was routinely told there are no gay students in the high school. That's an urban issue. Or if we have gay students, we get them help right away. Hello, what if they just want to make friends? So this was a big thing, even though it was this really silly, silly gesture, like let's do this thing because we can't have a softball game or a parade. And it turned out to unite these 4 different subdivisions that I didn't know were going to do this. I knew one of them was. I didn't know the other 3 were. So I wonder what it's like to be an LGBT kid living in that and seeing those pride flags go up. Because I know what it meant to the adults who were participating. That's big. Yeah. That's a really easy thing you can do. Make it visible.
It is amazing how something that seems so small can actually make such a huge impact for people.
Yeah.
Saw another question come in. This is interesting. What is the most LGBT friendly city in the country, and what are they doing right that
that's
learn from?
Yeah. That's well, that would be Nancy's opinion, not Youth Outlook's opinion. I can tell you from my own travels. So on the East Coast, I would say I have found Provincetown to be most friendly, and on the West Coast, San Francisco, and then going south, Key West.
Okay.
So in those pockets, the cities themselves are they have a higher population of LGBT people. In Provincetown, it's one of the few places in the country we can go where we're actually the majority, and that's a life-altering moment when you realize that you're the majority when you've been the minority your entire life, and it's all of a sudden safe to do the things that you see everybody else do, and now there are enough of you that nothing's going to go wrong. So that's a really big thing. Being able to move about freely and be public with our spouses and our families. I think Provincetown and San Francisco and Key West make that all very doable. They make it all very visible, and they put it out there that it's okay to be you. That's the place to go to be you.
Mm-hmm. Yep, I heard, unfortunately, last night or sometime yesterday, the pride flag that was flying at the Geneva City Hall was stolen.
Was it?
Yeah, so not the most welcoming gesture, but our mayor has promised to put it back up.
Well, Mayor Burns.
Replace it, yes. All right. And I think my final question here, I know when we have discussions about marginalized populations, it's easy to focus on the negative, all the bad things that need to be addressed and are important and critical conversations to have, but it's also really important to celebrate the beauty of those populations. So my question for you would be, and this will help us all celebrate Pride as well, because we may learn more from you. But I'd love to hear what your favorite LGBTQ author or book, musician, movie, any of the above, any people that you want to point us to that we could be celebrating and uplifting.
Absolutely. My favorite gay artist is Peter Thaddeus.
Okay.
He has a Facebook page. He is incredibly talented. He has started blogging and doing videos as well. Take your Kleenex because they're that funny. You will cry from laughing. Enjoy them. He brings color and brightness to our world every day. And favorite movie, I really appreciated Love, Simon. We finally got to have a happy ending. We didn't get murdered. We weren't the butt of the jokes. Nothing bad happened to us. There was no crime committed against. We got to have a love story. Love, Simon.
That's beautiful.
It's a wonderful movie. Yep.
Fabulous. All right. So if anybody hasn't seen or heard those, go check them out.
Yes.
I also heard that you have a new puppy, and I would also, and you said your puppy's name is?
Duncan.
Duncan. What kind of dog is Duncan?
Duncan's, he's just a Muttley that I rescued from the Buddy Foundation. He's got probably some pit bull in him and some hound and some border collie, and he has a big old smooshy face.
Those are great.
He's a good guy. He's at that puppy teething stage where everything goes in the mouth. He is all teeth. It is like living in Sharknado.
Yeah, I remember that stage. My youngest was just pointing out that they still have a scar on their hand from the first puppy.
Yeah.
Those embarrassing mom moments. Sorry.
That's okay. That's fine. So far, my most interesting moment with Duncan was when we were sitting outside. He was on his lead in the driveway, so he didn't bolt because he's not reliable recall yet.
Yeah.
And he got the lead wrapped around a chair while we were sitting there, and the chair was next to I do worm composting. So the chair was right next to the compost bin. And at the bottom of the compost bin, there's a little faucet where you drain off the water that has accumulated. And he sat down and bumped into it and proceeded to empty all of the worm juice all over his back end.
No.
There is a sentence I never thought I'd put together on my best day.
Washing worm
Life
juice.
with Duncan is interesting.
Oh, yes, I can imagine. And then I also wanted to hear more about your pastry chefing. Do you do that outside of home?
I did. I'm not currently.
Okay.
I went back to school in 2007. I decided that I wanted something else in my life besides social work. I was going to go do something else creative. And I fell into this culinary program at Elgin Community College and absolutely loved it. So I'm about 10 credits short of my pastry chef degree. I've done all the kitchen training. The last step is to go do an internship where you have to be in a kitchen for a set number of hours a week, and Youth Outlook schedule that would not work with that.
How are you going to do that?
No, I'm not. I'm stalled right here. But for probably 5 or 6 years, I ran a catering business with my ex-wife, and we had a blast. We were doing graduations and retirement parties. We did a wedding. It was really a lot of fun.
That's awesome. So
and now
is your
just
focus,
my friends benefit from my training.
I bet. Is your focus mostly on cakes, cupcakes, what are your favorite things to bake?
I was a big fan of the little bite-sized things, everything in the petit four family. So tiny petit fours, little tartlets, all kinds of
Those
little tiny
calories don't
cookies.
count, right?
Oh boy, did they count? Yeah, they counted in a big way.
Did
But
you
I had a
do?
really good time. In your chef's white, in your coat, there's a little pocket on the sleeve, and you have to carry tasting spoons in your pocket. And my chefs would chase us around the classroom going, "Where are your tasting spoons? You don't have your tasting spoons," because not only are you supposed to taste yours, you're supposed to taste everybody else's in the classrooms so that you know how they compare, because everybody would do a different flavor of whatever we were doing for the day. So yeah, those calories absolutely counted. But what a good time.
I bet. Have you done a lot of baking over COVID like everyone else?
Just some bread, some easy stuff.
Okay.
Yeah, trying to avoid the mousses and ice creams. Yeah, no. Not a good idea anymore. It wasn't time to bike yet.
Yeah, well, I wasn't able to avoid that as my kids took to baking during COVID, and when you're mom, you gotta eat it.
Yeah. Oh yeah. You can't turn that down. That would be rude.
So we did enjoy it. I had to get back to running though.
Yes, I just started biking last weekend. Yes.
Yeah.
Let's get rid of this.
Yep. Well, it's been a
Oh, thank you,
pleasure.
Paula.
It's been a pleasure talking with you, Nancy. I really
You as
appreciate all
well.
of your insights, and I look forward to taking a lot of that with me, hopefully when I win in November, but also just keeping it in mind in all the discussions that I have in the community. I think it's really important to keep this community top of mind as well. So,
thank you for inviting me to come chat with you today. I really appreciated it.
Thanks for coming. Take care. Bye.
Bye.